mentioned by Denise, basic life support, and the AED awareness. Now, AED is known as the automated external defibrillator. We are here today to understand what is this all about and what is out of hospital chain of survival. So as you can see, this is something that is introduced to the layperson as well as healthcare provider. The first 3 steps is always something that is provided by the bystander. That means the person that witnesses a cardiac arrest out of hospital. Let me remind you, cardiac arrest happens in hospital and there are doctors and nurses to help. But what do you do when it's in a public area or even at home? So BLS and the AED, this is not a provider and certification session. Oh, it's an awareness talk for today for non-medical individuals to learn how to identify what is cardiac arrest, understand what is cardiac arrest, and how to improve the chance of out-of-hospital cardiac arrest. So as you can see, this first responder is what you can do when you see something happening, maybe at home or in the park during a walk or a jog. So when you see somebody unresponsive or just collapses, quickly call 999 for help when you realize they are not responsive. And you need to get somebody to get the AED. And you should know how to do hands-only CPR. And as soon as AED arrives, use that. And until then, you need to continue these cycles until the ambulance arrives. Now, where do you anticipate a cardiac arrest that can happen? It's not just in the hospital setup. In fact, majority of this situation, we call this high-risk situation, it could happen in your home or anywhere else. So those who are in the high-risk risk of getting a cardiac arrest would be patients of cardiac diseases, diabetes, hypertension, or obese with multiple comorbidities, or even stroke in the past. Now, even caregivers of elderly parents or clients with medical problems. So you can understand it can just happen anywhere, in your home, in centers, or even in sports centers where there's high impact activities like badminton, futsal, martial arts. And what about building management, ongoing development projects, condos, or even companies, hostels, malls, and even amusement park? So let's understand what is cardiac arrest. Now, as you can see, this is a blood vessel. This blood vessel supplies the heart muscle. So there is a buildup of plaque, which causes narrowing of the blood vessel. So there is reduced oxygenation to the muscle of the heart. This is called ischemic heart disease or coronary artery disease. This is the most common type of heart disease. So this plaque will just build up and it can even rupture, causing an acute condition. So what you see, this is a narrowing situation where there's reduced blood flow to the heart muscle. And next, what you see here is once the plaque has formed in the blood vessel, one fine day, this can rupture and this material can leak out and enhance clot formation in an acute situation. And this will cause acute blockage of the blood vessel. Now, this is the most severe form that can happen. And this can be very painful and this is life-threatening. So to understand what is heart attack, what we went through is a state of ischemia when there's narrow blood vessel, reduced blood flow, reduced oxygen to the muscle of the heart, versus a myocardial infarction. So this is the terminologies the doctors usually use in the hospital, and sometimes without realizing, they use this language to patients and you wouldn't have a clue what are they talking about. So I want to clarify this terminology, right? So myocardial infarction, yeah. Sorry. Right. Myocardial infarction will be acute blockage, like I showed in the video. There's a blood clot, acute blockage, and there will be muscle damage. Okay, so you see that there's an ischemia. And if you don't do something about this almost blocked pipe, right, then it can lead to infarction. And once the infarction sets in, arrhythmia. Now, arrhythmia, if you can see the word rhythm, we have this lumped up rhythm of the heart, the pumping and relaxation of the heart. So arrhythmia means abnormal rhythms, and these could lead to cardiac arrest. Now, what is symptoms of heart attack? So we talked about this ischemia and infarction, but you need to know, okay, how do I know I'm going through this situation, right? So there is a sudden acute severe chest pain, but the pain can be sharp, there can be a discomfort, or just a chest tightness. In fact, some patients may not even describe a chest pain. They can have very, very vague symptoms, which I'll go through. Now, the common situation is that it could be in the central of the chest. It can go to the left side or the right side or the side of the neck, okay, even the jaw, the left arm, or even to the back. The character of the pain can be localized. It could radiate to your arms. It could be on and off. And it could even happen at rest versus exertion. Now, I will explain further what does this mean. These are the angina kind of pain, right? And the associated symptoms, or could be just the only symptoms, because remember, if you're diabetic, your nerves are damaged because of poor sugar control. You may not even experience chest pain, but you can come with vague symptoms like giddiness, generalized lethargy, feeling very tired, and you can have cold sweat, and then palpitations. That means you can sense your fast heartbeat on its own. And you just, sometimes you describe like you feel like your heart just going to pop out from the chest, And then you can even have epigastric pain. Epigastric pain, it could mimic gastritis, but it could be something different than the usual gastritis. And then you can develop nausea, vomiting, and even a headache. And the worst situation is the feeling of doom. You feel like going to die. The pain can be so severe. Okay. So what happens in cardiac arrest? So in cardiac arrest, the heart just has inefficient pumping with the abnormal rhythm, or it could just stop pumping, and then there wouldn't be enough blood flow to the brain or the vital organs. So that follows if this cardiac output is not restored. If it's not restored, this is a cardiac emergency, and this is a life-threatening emergency within minutes. So how do we restore this cardiac output? Of course, we need to do chest compressions. Chest compression will start to help pumping the heart so you can get this blood supply to your vital organs. And then you need to do defibrillation as soon as possible. So defibrillation is when you use this AED machine to kind of jumpstart the heart. So the defibrillation, I'll show the ultrasound picture, video of the fibrillating heart. Okay, so the heart is not pumping as usual, but it's just fibrillating. So we need to use the AED to jumpstart this heart, and then immediately after that, you start to get the rhythm back by chest compression. So what you see here is the pumping of the normal heart. So the heart pumps, you get the blood flow into the major blood vessels and to your vital organs. Okay, so in cardiac arrest, there will be no pulse because the heart is not pumping efficiently. There is no pumping, or there's no proper output at all. So there's no blood flow to the brain, so the patient can be unresponsive already because your CPU is out, right? And then there's no blood flow to the vital organs, and imminent death follows. So this is seen in a condition where the heart just stops in asystole right down there, or it could be just a fibrillating heart or pumping so fast that there is no proper cardiac output. So how do you identify if somebody is having a cardiac arrest? So you check for unresponsiveness or unconscious. They could just look cyanotic, bluish discoloration of the lips or the fingers. And they could even have fitting like seizure-like activity where the eyes can roll up, they can be twitching motions, or at the same time, they can even defecate or pass urine. And of course, for lay persons or the public, we don't talk about pulse because you think that it's difficult and checking the pulse is complicated. But let me introduce to you what can be done, all right? So this is an ultrasound of a cardiac arrest. The heart is fibrillating. Can you see that it's just vibrating? There is no proper lapped up that you normally see in a usual normal heart pumping situation. So, and then you talk about unconscious or unresponsive patient. So tap, shout loudly, shake and try to wake up this person. So if there's no response, no breathing, then there is no pulse. This is an established cardiac arrest. Okay, so no response, no breathing, no pulse. So what do? Call 999. Okay, our center for emergency, not 911. Okay, so we also understand that being unconscious doesn't mean always cardiac arrest. Of course, if you don't do anything, it could lead to cardiac arrest. So there is a situation when you have somebody diabetic on insulin, forgot to take their meal, they can go into hypoglycemia, and this person can be also unconscious. So if it's a non-diabetic person not responding, could be cold and clammy, just check if the person is breathing or check for pulse. This person is alive, so you don't have to do the CPR, okay? But get help quickly. But if you leave them to be hypo too long, the tongue will fall back, then they don't get oxygen, they will get a cardiac arrest. So same thing, if somebody gets a sudden stroke, they may not respond, but they could be breathing or sometimes choking on their own saliva or drooling with noisy breathing, but they're still breathing and the pulse is present. So they are alive. So don't do chest compressions, okay? And then they could be also in a deep sleep after on calls or too tired or overdose on medication. So look for evidence around the patient if this person has lots of sedative medication or overdose themselves, and then check for the breathing and the pulse. The other thing that could happen is electrocution, or even when somebody's eating and you can get choked, and if you don't relieve this choke with certain maneuver, and even trauma, falling from height or just slip and fall and hit the head, or severe allergy, okay, all these conditions, it is dangerous, but if you don't do anything in the long run, they can lead to cardiac arrest anyway. So get attention. It is an emergency, but what I'm trying to say is don't simply go and do CPR when the person is breathing and the heart is beating. Okay, so then we talk about how to check for breathing. So there's this maneuver we do to open the airway. So I have two pictures here. On your left is what you call a jaw thrust. So normally we do this because you don't want to move the neck so much if the person has had a trauma, maybe fall from height or slipped and fall, then you should not be moving the neck so much. You need to protect the neck. So all you do is lifting up the jaw upwards and to make sure the airway is patent, or a simple head tilt and chin lift, which is easy to do just to clear the airway. And then we look at the chest rise, listen for breath sounds, and feel the air from the patient's mouth, whether they are breathing or not. Okay, so this is how you do it. So she's tilting the head, lifting up the chin, looking at the chest, listening and feeling for the air from the mouth. Now, let's talk about the pulse. So carotid pulse. Carotid blood vessel is the nearest to the heart, and it's not difficult to feel for carotid pulse. All you have to do is place your finger at the Adam's apple, which we could normally call your thyroid cartilage, Adam's apple, and just move to the side, to your right or to the left, and you'll just feel a very strong pulse. If you don't have a pulse, you won't be able to sit here and watch us today. Okay, so you can feel the pulse. All right, this is easy to feel. Okay, but for the layperson, it's not necessary if you don't feel the pulse. If you find the patient unresponsive, looking with all those signs I told you and not breathing, you can immediately start CPR. Okay, so looking at the chain of survival, so let's refresh. A lay rescuer like you should immediately call for 999, start chest compression, use the AED as soon as available until the paramedic arrives with the ambulance. Okay, so the first thing that we should think of is clearing yourself from danger. Remember the time I said it could be a trauma or electrocution. So you wouldn't want to go and do all this if you find somebody in a state of electrocution, for example, with a pool of water or something, because you may also be the next person requiring cardiac arrest if you just blindly go and do something heroic without making sure you're safe to perform something. Or same thing like maybe a accident, trauma by the highway or something like that. Make sure the area is safe for you to do something. So make sure it's always safe for you before you do something heroic. And then the next thing will be to check for unconsciousness, then call for help. Now, a bit about calling for help nowadays. If you just scream and say, shout, help, help, or what, all you can see is people coming around you with their handphones, taking photos and going on live on social media. So you need to point a finger to somebody to become responsible and say, you call 999 and you get me an AED. Okay? And then you proceed to open up the airway, assess the breathing, and start the chest compression. In a nutshell, whatever I said just now is something abbreviated to doctor's ABCD. So check for danger, protect yourself, then check for response of the patient, then shout. Shout means that you call somebody and show the finger and say, you please call 999 and you please get me an AED if it's available. So there are AEDs available in Malaysia, as I've noticed, in the malls and in the airport, but yet there are many other places that really requires AED, and that is something that we need to look forward to. All right. And then you talk about clearing the airway, check for breathing, and then circulation will be like checking for the pulse, no, and then start the CPR, and then you defibrillate the patient. Okay, so when do you stop chest compression? It's only when you're just too tired and you feel like collapsing, or continue your chest compression until the AED arrives. Now, when the AED arrives, immediately stop your chest compression and put the pads on as directed by the AED set, and it will say shock is advised or continue chest compression. So you provide good quality chest compressions while help arrives. Why I mentioned this? Good quality chest compression. Okay. This is the pad that is attached from the AED. And you can see there's a cross sign over here. This is where you would place your hand to provide good quality chest compression. Now, the pictures on the pad is very simple to understand, and the gadget here talks to you. It will tell you what to do. Now, there are many AEDs in the market. So to understand the AED, usually there will be simple instructions like expose the patient's bare chest, attach the pads, do not touch the patient because it wants to analyze the electrical activity of the heart. So it analyzes the rhythm. And if it thinks that the rhythm is chaotic, like the ventricular fibrillation video I showed, then shock will be advised. So when you're going to shock the patient, don't touch the patient, just press the button and shock the patient. Because if you're touching the patient, you may also get the electrocution. That is very dangerous. So just shock the patient and then start the chest compression immediately. Because remember, when the heart is fibrillating and you provide the shock, it will get stunned. So you need to start the chest compression to get the rhythmic cycle back in place. So there is also a situation when the heart is not even fibrillating, all right? It will be just stopped. So in this situation, the AED will not advise a shock, so it will prompt you to continue the chest compression. Now, what is shock? Actually, this shock is actually called defibrillation in our medical terminology. So this is the best treatment. Shock as soon as possible, followed by chest compression. This is the best treatment for ventricular fibrillation. This is the best outcome for the ventricular fibrillation to prevent cardiac arrest. So don't delay shock if it's required. And giving the shock as soon as possible improves the survival of the victim. And continuous cycles of chest compression, analysis by the AED, and shock. It's just a cycle that continues, okay? Now, I talked about good quality chest compression, right? So for good quality chest compression, you need to know, don't get so complicated or confused. Previously, there were measurements and so on, but don't worry. As long as you know this central chest, okay, you have this bone, the sternum, okay, the heart sits behind the sternum. So all you have to do is place your hands, your palms on the center of the chest, push hard, push fast, about 100 to 120 times per minute. And if you were unable to decide how fast is this in per minute, think of the song Staying Alive, follow that rhythm, okay, in a depth of 5 to 6 cm. Avoid interruptions during CPR, which means don't pump a few times and then stop to check or do something. You have to make sure the chest compression is continuous, uninterrupted. And you should also allow full recoil when compressing the chest. Because remember, the heart has cavity filling up with blood. So if you continue to compress without allowing the recoil, the blood is not going to fill up to the heart. So you need to press and let go, press and let go. There need to be a full recoil of the chest. So what you see here is a life pad. All right. So this life pad is a real-time CPR feedback pad. It's a single use with battery life of 1 hour. And for bystander CPR, there's a metronome to guide you in achieving the appropriate rhythm and depth. So the light and it's really light and portable and easily available. So when you talk about 100 to 120, you just follow the beep and that sorts it out. Now, with regards to chest compression system, something I want to introduce to you, because when you see this, you may get frightened and thinking, oh my God, what's happening? It's like some kind of robot. Okay? Yeah. Okay. So it looks scary, right? So this is a robotic system. It's a chest compression system. Why was this created? It's because this is a continuous, uninterrupted, effective chest compression with a constant rate, with a constant depth, which is appropriate. And if provider fatigue is avoided, because it's not easy to do chest compression continuously on someone, especially imagine if somebody is really big size or obese. So if you were to have a cardiac arrest situation somewhere outside and then when the ambulance comes, quite a number of Malaysian ambulance services have this chest compression system that will be attached on site. And then while the chest compression is going on, they are able to transport this patient into the ambulance and to the emergency department because you want to have a uninterrupted, good quality chest compression. So while waiting for ambulance, there is two scenarios. If during the chest compression with the AED guide, there is still no pulse, the AED will keep on prompting you to continue the chest compression, only shock if required. So this is going to be a continuous chest compression, okay? But if got pulse, when the pulse comes back, this ROSC is what we call return of spontaneous circulation, which means the heart can spontaneously pump back to the lapped up rhythm, getting back the circulation. So the AED will prompt to stop CPR, and then you should know how to put this person on a recovery position so that they don't aspirate and choke on any vomit or chicken rice that they had earlier, or basically aspiration of these products into the lung and cause more problems, right? So you need to put the person on recovery position. And then if the person is not breathing well, but the heartbeat is back, you can also learn to give rescue breaths, all right? So what you're going to see here is a simple way of doing recovery position. All right. So this is simple. Also, you can learn during programs for CPR and AED. This is also taught. So recovery position is something important to avoid aspiration. And you do all this until help arrives. Okay. Now, if you are interested further, you can take a snapshot of this website where there's a manual for CPR for the community. We use this as a guide to teach the community group within your household, your tamans, or in the mosque or the temples. You know, these activities are going on, and it will be a very good guide for you to read and learn and understand what is it all about. Now, somebody asked me, what about mouth to mouth? I used to see in Baywatch, right? People giving mouth to mouth and CPR, and those are all cute people. Or it's okay to give mouth to mouth to your girlfriend or something like that. But would you want to give mouth to mouth with somebody with oral cavity like this? I'm sure not, right? So chest compression only CPR has been advocated for a layman bystander CPR because we want to prevent hesitation to start CPR on a stranger. Okay, so this will delay inadequate quality ventilations, compressions, and also the detrimental effects on interruption on chest compression, especially when you decide to do mouth-to-mouth ventilation. Doing that maneuver itself could waste your time. The priority is chest compression. And of course, we want to prevent risk of infection, all right? But also remember, our circulating blood has got some dissolved oxygen. So with the CPR, the chest compression on the CPR, this oxygenated blood is sufficient for the first few minutes for chest only compression. So don't worry about mouth to mouth, okay? Now, some people are confused between what is angiogram, angioplasty, and so on. So let me go through something simple. So we have something called angiogram, some terminologies like percutaneous angiogram or CT angiogram, right? So percutaneous is something that they will set a line into your blood vessel. It could be in your wrist or your groin area. So they can do an injection of contrast into your blood circulation that goes to your heart, and then there will be real-time x-rays taken to see where is the block in the blood vessel. But a CT angio is just one-time contrast into your bloodstream, and the moment it reaches the heart, they'll start to take CT scan images of your heart. So this is called angiogram, PCI, percutaneous coronary intervention. So what you can see here on your left is a real-time X-ray photo shot of a blood vessel that was actually clogged at somewhere here. And then after the intervention of opening up the narrowed blood vessel, this blood vessel has been achieved circulation. So some rescue process. So this is a primary coronary intervention. That means this the first thing should be done as soon as possible. Okay, right. And what you see here are all the blood clots that has been aspirated during the procedure. Can you see this little small piece, or even these little small pieces here? All these are the blood clots after a plaque rupture. So during an angiogram, they will put in some devices to aspirate the blood clot, and they will do stenting to open up the blood vessel and keep it patent. So all this is done by the cardiologist. All right. So angioplasty is when we do procedures, minimally invasive. Actually, it's not a major surgery like these people are afraid of angioplasty and so on, right? So this is actually minimally invasive. So maneuvers are done to get the blocked arteries or the narrowed arteries using balloons. So they call it balloon angioplasty. Just blow up the place, open it up. And then this is also known as percutaneous transluminal angioplasty. And this frequently involves stent placement. This stent can be also medicated to avoid blood clots forming in it. So they put a stent and to keep the blood vessel patent. All right. So what you can see here is angioplasty. Widen the narrowed blood vessel with the stenting. and something called a bypass grafting. So in bypass grafting, what you can see here is this blue blood vessels. It's from a donor from the leg. From the leg, they will take blood vessels. So they do grafting. That means they will transplant the blood vessels from your leg to the heart to produce a bypass so that there's blood supply to the heart that is not getting the blood supply. So at the end of the day, prevention is better than cure. So with diet modification, lifestyle changes, and proper medication, if you're diabetic or having high cholesterol or hypertensive, you can avoid all these complications. All right. And this is another video of angioplasty with stenting. Okay, so you can see the plaque buildup, restricting the blood flow to the heart. And then we have the stents used for the coronary arteries, made of a metal mesh, and it's usually medicated. And with the catheter, this is placed there. And then eventually that is a new passage of patent blood flow, all right? And then you have to continue medication. Remember, we always get patients sometimes stop taking medications after this procedure. You'll be prescribed with blood thinning agents. You don't want this stent to get clogged with blood clots, right? So it's such a waste of time doing all this procedure and then you just don't take care of it. So it's just like plumbing at home. Huh? If you get chokes, you have to keep putting in some medication to keep the drains unclogged, right? So you have to do this, right? Okay, so I want to share something. This is a screenshot of my WhatsApp. So we have something called the STEMI network from my Putrajaya Hospital with Serdang Hospital. Why I want to share this with you is because how we help to save patients' life, really practically save patients' life. All my fellow colleagues from the emergency department are the first frontliners to receive patients like this. And this happened just recently. 44-year-old, no known medical illness, but except a smoker. He's 44 years old. He had epigastric pain, shortness of breath with central chest pain, went to the GP. GP is a general practitioner. And he couldn't bear the pain, so he's lying down at the GP and suddenly he collapsed. So the doctor found out that he's having a cardiac arrest. So he started a CPR after calling for help. So our paramedics arrived. They started the CPR. They gave him shock, and then reached in my hospital with that mechanical CPR machine ongoing. And then he achieved spontaneous circulation at 8:45 after about 25 minutes later. All right. GM, his sugar was high because of acute stress reaction. And when I saw this patient after cardiac arrest, basically he was dead and he was back. He was alert and he was talking, he was moving all limbs. Imagine if there's no blood supply to the brain, he could have had stroke-like symptoms, he could have been confused, he would have had paralysis, nothing. So this means the GP did a very good job doing very good chest compression, and the paramedics did a very good chest compression, and this patient came back alive without any pathological presentation. So then I quickly referred to our team. So we have a WhatsApp group to the cardiologist. They asked to send this patient immediately. So the patient reached there within 15, 17 minutes. And then angioplasty was done. He was sent back to our hospital well and good, and he was admitted to the ICU for monitoring. So what I'm trying to say is, when there is a situation where somebody has a cardiac arrest, there is still hope if you can do good chest compression and get immediate attention as soon as possible. All right. So in a nutshell, this is a summary of what you can do as a bystander person. Let's watch this. Okay, so what you can see, the importance of having an AED in a place where there is risk of cardiac arrest, you can understand what has been explained today. And then there are questions like, Doctor, where can I get this AED? Can you recommend AED? So I'm not here to sell AED, but these are the things if I were to have an AED in my home, because there are people who have AED in their car or in their home, and there are things that we need to know is what are the things you need to ask is it easy to use? Because you're not a medical person, so you're not supposed to be like being able to understand how is the ECG rhythm going to be, because the one that we use in hospitals, they have those ECG cardiac monitors and so on. So we learn that so we know what to do. But for public, you need to understand that it has to be easy to use. So high quality CPR assisted by voice prompted AED. So the AED will be a smart machine using voice to guide you what to do. Okay, then there should be an accelerometer based feedback, which means it's a gold standard for rate and depth. US FDA approved or MDA certified. So it's like a feedback. So if you see the video earlier, when he stopped chest compression, the AED said, continue chest compression. And when the chest compression is shallow, he said, uh, improve on your chest compression because you need to achieve 5 to 6 centimeters depth to get the heart pumping. All right. And of course, it has to be fully compliant with the international resuscitation guidelines. Okay. So for qualities of recommended AED for non-medical will also mean that you want to keep something with low maintenance, because in hospitals, we kind of use AED almost every day. But in the house or in centers, you might be sitting there and one fine day, something can happen and you want to use it. So you really, really hope nothing happens, right? But if it happens, it's going to be very rarely. So keeping the AED somewhere safe with the batteries, right? You may be wondering, like, what if the battery goes weak and so on? So think about something low maintenance, long lasting accessories, or good warranty period. There are AEDs with 7 years warranty, or one-to-one replacement if there's any damages. All right. And then the battery types also. Those days, the AED kind of like dies off after using several times. The battery is already inbuilt, so you need to spend your money to buy a new set of AED. You can't use the same thing. So now it's like refillable batteries, right? So if the battery is dead, we can just get the battery in 7-Eleven and just top it up. And of course, the AED should be also smart to have a weekly self test. Yeah, so there's an auto calibration. So if you can see here, there's a corner that says X. That means the battery is gone, so you need to change the battery. And then here you see the green light is there, so means that the battery is good to go. So it will provide effective shock to the patient, right? You want that certain amount of electricity for it to be effective. Okay, so I would like to thank you for listening to me today. And I think, Dennis, we can open the floor for any questions.
Yes, thank you. Thank you very much, Datin. And yes, we'd like to open the floor right now. If you have any questions, please unmute yourself and switch on your camera, or you can type your questions in the chat. Let's see. I think
Hi,
there are some
Datin.
questions here.
Denise, yeah, this is Sandra. Thank you, Datin, for sharing this valuable information. I just have one question, which is, what if a person suddenly collapses and while you're checking their airway, you can see that they're gasping for breath? Do you still start CPR?
Okay, right. So that's an important question. So when somebody is gasping or not breathing, start the CPR, because gasping is ineffective breathing, and gasping is actually already almost near death. So basically, their pumping of heart is failed already. So that's why somewhere there I did mention no breathing or gasping, you can start the CPR. So if you were to able to open up the community CPR guidelines, it's also clearly explained over there. When you have time, when you're free time, just go through it. So remember, no breathing or gasping, you can start CPR.
Thank you very much.
Thank you very
There's
much.
another question here from Jaya Morgan. How frequent we need to do CT angiogram?
High frequent CT angiogram. Okay.
How
So
frequent?
okay. So there is no hard and fast rule to tell you when you should do. But remember, with this current period of time, a lot of people are developing comorbidities like diabetes and hypertension and cholesterol at a very young age. But in fact, I've seen people at the age of between 18 to 20 even having a cardiac arrest. Okay, so it could be many reasons, but if your family has a high risk, like your paternal or maternal relatives and parents and so on, having high risk of cardiac problem, and if you have medical problem at a very young age, then you need to go for a cardiac assessment first. Cardiac assessment is something that can be done in any hospitals under medical physician advice. So you can go for an echo and a stress test. And if there's anything significant, then you will be referred to the cardiologist for a further investigation, which includes an angiogram. So this is the usual process that's being done in a government hospital. But if you have the capacity to do a medical checkup, of course, if you don't have any problems, once you are about 35, I think it's time for you to do yearly medical checkups. And that could include a chest x-ray, ECG, and if you want, if there's something suspicious or you do have some symptoms or you have some medical problem already, like if say your fasting sugar is high or your BP is somewhat borderline and you started to have some cholesterol and you know you have been not on a very good diet and with a sedentary lifestyle, which we all are usually a victim of, right? So then you should consider going for stress tests and echo and so on, right? So the angiogram is not something that you can just go and tell the doctor, hey, doctor, I want to do a CT angio today. No, there should be an indication first.
Okay. There's another question here. I have a family with elderly members. I'm hoping to get an AED. Where can I get this? From Vanisha.
Okay. Okay, so you can get AED if you were to look for it on the website, so online purchase or something like that. But remember, I've mentioned the qualities of a good AED for a lay person, for something that is low maintenance and easy to use and not complicated, and somewhere where you can keep in the house or something like that. So of course, if you are really, really interested and you're not sure, then you can DM me and then I can guide you where and what are the recommended AEDs available in the market. In fact, there are situations and packages where when you purchase the AED, then there will be a free BLS and AED CPR training for the buyer and the family members, immediate family members, so that you know how to use it and you're confident to do it. Remember, the idea is I'm not asking you to go for a course and get certified and be a certified provider. What you want to learn here today is being able to help your loved ones or your friends at a time of emergency. I think in that way, you don't actually need a certificate to show off, just to help somebody and save a life. Life is so precious. And imagine if you could just get them back to life just by knowing what to do. And this is something doable, folks. So try your best to, have the initiative to learn and do something about it.
We have another question from Vashila. Is it safe to use AED on children?
Sorry?
Is it safe to use AED on children?
Actually, AED can be used for children as well. But again, we have different size beds in the hospital. But remember, for children, the commonest reason for a cardiac arrest is usually a choking episode. Heart problem is only more common in adults because of comorbidities. Like, remember, I talked about the coronary arteries and getting blocked. You don't get these problems in children. Children, most of the time, they get asphyxiated from the milk that they drink or vomiters. So you need to learn how to clear the airway and get the breathing efficient. So that is why when you go for CPR training, we also teach you how to do CPR for babies and children and how to clear the airway. Like if there's a foreign body or something like that, how you do Heimlich maneuver. So these are the things that can be taught for you to learn. These are all emergency situations for first aid that everyone should know.
Another question is from Miss
Yeah.
Sandra. What if I'm alone at home and I'm facing symptoms like chest tightness? What should I do?
Call 999. Okay, call 999. If you think the ambulance is going to be late, just get your neighbor or somebody to help and get to the emergency as soon as possible, the nearest emergency department. Don't Google and look for cardiologists and try and make an appointment tomorrow. Something can happen to you at night or in your sleep. Have you heard of people went to sleep today, yesterday, he's found dead? Okay,
Yes.
so these are the scenarios that can happen. So if you have something I described like chest tightness or discomfort out of extraordinary, and you know this pain is excruciating, and you have medical problems and doctors have warned you of a risk of heart attack. In fact, remember, if you have diabetes, hypertension, and cholesterol, these three buggers are good enough to start off a cardiac problem in yourself. So be cautious about it. That's why I want you all to be aware of the symptoms of chest pain and seek for emergency, because nowadays, I mean, not nowadays, it's been many years, as a trained emergency physician, I want you all to know that we do a lot of things in the emergency department. And most of the government emergency department and even the private, we have emergency physicians trained to diagnose the heart attack and get immediate attention. Together, they can treat you with clot busting agents and then refer to cardiologists for emergency angiogram. A lot of things can be done. So that is really, really important for you to understand, when to go immediately to hospital. So call 999 if you don't have anyone to assist, or if you have a neighbor or somebody, get to the emergency department as soon as possible.
The other question is, thank you, Datin. The other question is, what is the best approach for a person who has DNR tattoo on the person?
Sorry?
What is the best approach for a person who has DNR tattoo on the person?
Okay, so DNR means do not resuscitate. So first of all, I need to know whether this tattoo was something that is aware by the family member. And usually when a do not resuscitation order is given, that means this patient is terminally ill. So they may have some terminal stage cancer or failing kidney or something like that. And usually the caregiver or the family member would be advised and told accordingly as well. So we get this type of patient very frequently to the emergency because the family can't see the patient gasping and so weak or fainted and become unresponsive. So eventually they'll come to the hospital. So we will try and give all the basic necessities to keep the patient stable, as in something that is reversible, but do not resuscitate. Means if the heart stops, we don't do CPR. So if the family is confident and you have been advised and counseled, then the patient is allowed to let go comfortably. I know it sounds very scary, but this is the reality. You know, if the patient is already terminally ill, and you can even get hospice to come over, they could help to give some pain medication and make their last minutes comfortable.
Okay, thank you. We have one more question, which is, will you be doing any sessions for children resuscitation?
Sessions as in this platform?
I guess so.
Okay, so
That's what they will change it to.
I mean, as emergency physicians and trainers, when we do CPR courses and with the AED and all, it includes children CPR as well, starting with a child, a pediatric infant, as well as a walking pediatric patient. So we will start off with foreign body obstruction, so on, and then what we do for cardiac arrest. And also, these are all a part of the curriculum when we're doing CPR training per se. But if at all say there is any need for a platform like this, of course, in the future we can work out something.
Okay, thank you. And then we have another question. To obtain an AED for contingency purposes, will it come with any training session, certification to use for third-party AED administration?
Okay, so like I said, you don't need a certification to use, but when you get a AED, it depends on the supplier of the AED for you to discuss on what are the availability for training sessions, so on. Like I personally feel that when you get a gadget, you should know how to use it. So there are companies like Zoll, they would provide AED if you want to get, and they will liaise with any of the physicians to help train for the use of AED. Because you remember, going for a BLS and AED cost per se, if you were to Google the prices, it could be quite costly per person as well. So if you were to do it for a contingency purpose in a place where there is so many people interested to learn, and then it's going to be a very big crowd, and then you need to get the facility sorted out, you need to get the mannequins for you to get the feel of CPR, you know, all this will involve cost and time. So you need to speak to the provider of this AED. But of course, you don't need to be certified to use the AED unless you want to go for a certification course, and then you need to sit for the test to pass the exam to get certification.
Right.
Okay, that is important if you're going to join the healthcare or work in a clinic or something like that, or probably for your CV or resume. But this is something, this awareness today is something about how you can provide care for your loved ones when a cardiac arrest happens. So what I'm trying to encourage is, being a layperson doesn't mean that you cannot learn CPR.
Yeah, thank you so much, Datin Dr. Sri Lata. We have really learned, I think, lots. I have, and I do believe everyone on the platform tonight have learned so much. And we'd like to also thank everyone for all your questions and for your kind participation. Now, let's take a quick group photo, everyone. So please switch on your webcam.
Are you guys ready? All right.
Okay. Yes, is everyone ready? Okay. Are we ready, Ritesh?
Yes, I'm ready. 3, 2, 1. Thank you.
Wonderful. All right. Let me quickly move on to the next part. Okay, just a moment. Okay, now we will be having more sessions coming along, and our upcoming VIP session is in May, and it's called Confidence Revolution. Glow up with confidence. We need to glow up with confidence. I think it's a very good topic, and so it'll be on Wednesday, May 15th. Yeah, 2024. It's from 8 p.m. to 9 p.m. It will be in the English language, and you may scan the QR code to register. Okay. All right. If you like to take that. Now, moving on. Okay. We have prepared e-certificate of attendance for every VIP session. So to receive a VIP cert, please scan the QR code on the screen, fill in the Google form, and click submit. The e-cert will be sent to your email within 48 hours. Now, a reminder, please check your inbox and your spam box, because sometimes it may just get into your spam box and you might not know that you have received it. All right. And now we are at the end